Imagine going to bed feeling fine, but waking up unable to move your arm, your speech slurred, or your balance gone. No warning, no pain, just a stroke overnight. You're doing everything right, taking vitamins, eating healthy, staying active, but one tiny pill could be silently raising your stroke risk while you sleep. As a brain doctor, I've seen too many patients lose speech, memory, or mobility because of this one mistake, and most never knew what caused it until it was too late. Today, we're exposing 5 common vitamins that can harm your brain if taken the wrong way, and how to use them safely so they protect you, not hurt you. Before we dive in, tell me in the comments, do you feel younger or older than your real age right now? Your answer might inspire someone who feels the same. Most people believe strokes are caused only by high blood pressure, smoking, or poor diet, but there's another, quieter culprit that almost no one talks about. Every day, millions of seniors take vitamins thinking they are adding years to their lives. And while many do help, a few, especially when taken in high doses or at the wrong time, can do the opposite. These hidden risks can thin your blood too much, spike your calcium levels, raise your nighttime blood pressure, or quietly damage your nerves, creating the perfect storm for a stroke or brain bleed. The scariest part, you won't feel a thing until it's too late. No pain, no warning. Just one morning where everything changes. But this is not about fear, it's about prevention. When you know which vitamins to check, how much to take, and when to take them, you can keep them working for you instead of against you. Let's start with the most surprising one. A vitamin you've been told for years is essential for bone strength and mood, but can quietly harden your arteries if you take too much. Here's what makes this urgent. Every 40 seconds, someone in the US has a stroke. That's over 795,000 strokes a year, and nearly 1 in 4 of those happen to people who already had one before. For seniors, stroke is the #1 cause of long-term disability. It can steal your speech, your memory, or even your independence overnight. And most people never see it coming. The heartbreaking part is, many of these strokes could have been prevented. In my own practice, I've seen patients who were eating well, exercising, and yet the silent factor was in their supplement routine. This is why you need to know which vitamins to double-check, because some can quietly raise your risk without a single symptom. If you know someone over 60 who takes daily supplements, share this video with them right now. It might save their life. Before we dive into the first vitamin, take a moment to think about your daily routine. How many supplements are on your nightstand or in your kitchen right now? Some of you may have a whole pill box labeled Monday through Sunday. Others might just take a single capsule after breakfast. Either way, what's inside those pills matters more than most people realize. Because the very thing you're taking for energy, strong bones, or better sleep might be the reason your blood pressure spikes at night, or why your arteries are stiffening silently. And when your arteries stiffen, it only takes one clot, one sudden pressure surge to set off a stroke while you're asleep. The good news is you don't have to throw your supplements away. You just have to know which ones to keep, which ones to avoid, and when to take them. Comment below with the number of pills you take daily. I've personally read and reply to every comment, and I might even share a tip that's perfect for your routine. Now, let's reveal the first vitamin on our list, the one most associated with strong bones, but also the one that can silently raise stroke risk if you take too much.
Vitamin number 1, vitamin D. You've been told for years that vitamin D is essential for your bones, your immune system, even your mood, and that's true. But too much vitamin D can quietly turn dangerous. When taken in high doses, especially at night, vitamin D can push too much calcium into your bloodstream. That calcium can settle in your arteries, making them stiff and narrow, setting the stage for a stroke. Take Mr. Walter, a 74-year-old Navy veteran I met in my clinic. Every morning he lined up his supplements, including a 10,000 IU vitamin D capsule. He thought he was protecting his bones, but one morning his wife found him slurring his words and unable to lift his right arm. His calcium levels were dangerously high, his arteries stiff. The culprit? Vitamin D toxicity. Studies show that excess vitamin D raises calcium levels and blood pressure. For older adults whose arteries are already less flexible, this can create a perfect storm, especially at night when blood pressure naturally spikes. The solution isn't to stop vitamin D altogether. It's to take the right amount at the right time. Most seniors only need 600 to 800 IUs per day, sometimes up to 1,000 IUs if deficient. And it's safest to take it in the morning with food, not before bed. Check your supplement bottle right now. How many IUs does yours have? Comment D below and tell me. You might be surprised by what you find. If that surprised you, wait until you hear about the next vitamin. It's often called the heart helper, but in high doses, it can make your blood so thin it leads to brain bleeds. Vitamin number 2, vitamin E. Vitamin E is often called the heart helper. Many seniors take it daily, hoping to boost circulation, protect memory, and keep their skin healthy. But in high doses, vitamin E can turn from helper to hazard. Vitamin E acts like a natural blood thinner. If you're already taking aspirin, Plavix, or warfarin, combining them can make your blood too thin. That means even a tiny vessel in your brain can burst, leading to a brain bleed. Mrs. Evelyn Brooks, an 81-year-old retired librarian, took 800 IU vitamin E capsules for memory support. She was also on a prescription blood thinner for her heart valve. 3 weeks later, she was rushed to the ER with a splitting headache and confusion. A scan revealed a hemorrhagic stroke, bleeding inside the brain, not caused by a fall or high blood pressure, but by blood that was too thin to clot. Most older adults only need about 15 milligrams, 22 IUs daily, and they already get that from food like nuts, seeds, and spinach. But most store-bought supplements contain 200, 400, even 1,000 IUs per capsule, up to 40 times what's needed. You don't have to give up vitamin E entirely. Just get it from natural food sources, or if you take a supplement, stick to a low dose, and always check with your doctor first if you're on any heart or blood pressure medication. Go grab your vitamin E bottle. How many IUs does yours have? Comment E below, and let's see how many of us are taking more than we actually need. If the idea of a brain bleed worried you, the next vitamin might surprise you even more, because too much of it can quietly damage your nerves, causing numbness, tingling, and even falls. Vitamin number 3, vitamin B6. Vitamin B6 is often sold as a nerve support or brain booster, but here's what most seniors are never told. Too much B6 can quietly damage your nerves, sometimes permanently. Excess B6 builds up in your system over time, stripping away the protective coating around your nerves, like taking insulation off an electric wire. The result? Tingling in your feet, numbness, poor balance, and even falls. Mr. Harold Jenkins, a 76-year-old trucker driver, came into my office after falling 3 times in 1 month. He thought it was just old age, but when we looked at his supplements, he was taking 200 milligrams of B6 every single day, 10 times the safe upper limit. His nerve damage had already begun. We stopped the supplement, and while he didn't get worse, he still uses a cane. The recommended amount of B6 for seniors is only 1.5 to 2 milligrams per day, and most people get that from food like poultry, fish, and bananas. But many brain support pills sold online contain 50, 100, even 200 milligrams per capsule, far more than your body can handle safely. B6 is still essential, but only in small amounts. If you're taking a supplement, look for one under 10 milligrams per day unless prescribed by your doctor, and get as much as possible from food, where the levels are naturally balanced. Check your nerve or brain health supplement label right now. How much B6 does it list? Type B6 in the comments, and I'll tell you if it's in the safe range. If nerve damage scared you, the next vitamin might surprise you even more, because too much of it can actually mimic the symptoms of a stroke by increasing pressure inside your brain. Vitamin number 4, vitamin A. Vitamin A is praised for healthy vision, skin, and immunity, but too much of it can quietly build up in your body and create pressure inside your skull that mimics a stroke. High doses of vitamin A don't just flush out like vitamin C. They get stored in your liver and tissues, slowly building to toxic levels. Over time, that can lead to headaches, dizziness, nausea, blurred vision, even slurred speech and confusion. Miss Dorothy Simmons, a 79-year-old retired piano teacher, thought she was doing the right thing by taking a high-dose eye and skin supplement for years. One day, she developed headaches, then blurred vision, then difficulty speaking. Her family rushed her to the hospital fearing a stroke. The scans showed no clot, no bleed, but dangerously high intracranial pressure caused by vitamin A toxicity. The safe upper limit for vitamin A in seniors is about 2,500 to 3,000 IUs per day, but many multivitamins, skin, and eye supplements contain 5,000 to 10,000 IUs or more. Taken daily for months or years, this can quietly damage your brain and eyesight. You don't have to stop supporting your vision. Just choose balanced multivitamins or get vitamin A from food sources like carrots, sweet potatoes, and leafy greens, which are safer and less likely to build up to toxic levels. Take a look at your eye health or skin supplement. How much vitamin A does it have? Comment A below. You might be shocked by what you find. If vitamin A can mimic a stroke, wait until you hear about the last one, a vitamin that can cause sudden spikes in blood pressure and trigger mini-strokes if taken in high doses. Vitamin 5. Niacin, vitamin B3, the blood pressure spiker. Niacin, also known as vitamin B3, is often praised as a natural way to lower cholesterol and support heart health. But in high doses, niacin can secretly do the opposite and put your brain at risk. Niacin causes your blood vessels to suddenly widen, which is why your face may flush or feel warm. But just as quickly, those vessels constrict again, creating blood pressure spikes and drops that stress your heart and reduce blood flow to your brain. Over time, this yo-yo effect can trigger mini-strokes. Mr. Frank Miller, age 72, a retired postman, came to see me with strange symptoms: hot flashes, pounding in his chest, and dizziness every morning. His family thought it was just anxiety, but he'd been taking 1,000 milligrams of niacin twice a day in an over-the-counter heart health supplement. One morning, Frank had a TIA, a mini-stroke that left him slurring his words for 2 minutes before they returned. Most older adults only need about 14 to 16 milligrams of niacin daily, easily met through food. Anything above 50 milligrams per day should only be taken under medical supervision. But many supplements sold online contain 500, 1,000, or even 2,000 milligrams per dose, enough to cause flushing, arrhythmias, and sudden blood pressure swings. Niacin can still be helpful when used safely and under a doctor's guidance. If you're taking it for cholesterol, ask about safer options like dietary changes or prescription alternatives that don't create dangerous pressure spikes. Check your heart supplement or multivitamin. Does it list niacin? Comment B3 with the dosage you find. You may be taking more than your body actually needs. Now that we've uncovered the 5 vitamins that can raise stroke risk, let's talk about what to do instead and which foods and habits can actually protect your brain and keep your arteries clear. Now that you know which vitamins can raise stroke risk, let's talk about the safer way to nourish your brain and body without risking your health. The truth is, your body was designed to get most of what it needs from food. Whole, colorful, nutrient-rich foods deliver vitamins in safe, balanced amounts, the way nature intended. Here's what I recommend to my patients. Leafy greens like spinach and kale for natural vitamin K, folate, and antioxidants. Fatty fish like salmon, mackerel, or sardines for brain-protecting omega-3s. Berries for polyphenols that reduce inflammation and keep blood vessels flexible. Nuts and seeds for vitamin E in safe, food-based doses, no megadoses needed. And whole grains to keep your blood sugar stable and protect circulation. Studies show that seniors who focus on real food, like in the Mediterranean or DASH diet, cut their risk of stroke by up to 30%. That's not a pill, that's a plate of food. Start small. Replace one supplement with a food source this week. Swap a vitamin E capsule for a handful of almonds, or get vitamin D from a morning walk and a piece of salmon. You might be surprised how quickly you feel the difference when you feed your brain and arteries what they truly need, in a form your body recognizes. Tell me in the comments, which one of these foods will you try first this week? Your choice might inspire someone else to take that first step toward better brain health. Now let's put it all together so you have a clear, daily routine that keeps your arteries flexible, your blood pressure steady, and your mind sharp. Step-by-step daily routine and timing guide. Knowledge is only powerful if you can put it into action. So here's a simple daily routine to protect your brain, keep your arteries clear, and lower your stroke risk starting tomorrow morning. Morning routine. Morning hydration. Begin your day with a glass of room temperature water to hydrate your brain and improve circulation. Safe vitamin timing. If you take vitamin D, take it now with breakfast, never at night. Breakfast. Pair a protein, like a boiled egg, with a healthy fat, like avocado or a handful of walnuts, and a slow carb, like whole grain toast or oatmeal. This combination keeps your blood sugar steady. Midday routine. Move gently. A short 10-minute walk after lunch helps keep blood flowing and prevents sugar spikes. Leafy greens. Include spinach, kale, or other greens for natural vitamin K and magnesium. Evening routine. Avoid late-night supplements. Skip high-dose vitamins before bed, especially vitamin D or niacin.
Light dinner. Choose a palm-sized portion of protein, fish or chicken, colorful vegetables, and slow carbs like sweet potato to prevent blood pressure spikes overnight. Stay active daily. Gentle movement, walking, stretching, tai chi improves circulation and keeps arteries flexible. Sleep support. Aim for 7 to 8 hours of restful sleep. Poor sleep can raise blood pressure and stroke risk. When you follow this simple schedule, you give your brain what it needs to stay clear, sharp, and resilient, while protecting yourself from silent dangers that build up over time. Which of these daily steps will be easiest for you to start with? Comment below, and let's build a morning and evening routine together as a community. Now that you have a plan, let's talk about the biggest obstacles most seniors face when trying to follow it, and how to overcome them without feeling overwhelmed. Overcoming common objections and barriers. I know what you might be thinking right now. This all sounds great, but it feels like a lot to remember, or maybe too expensive, or maybe you're just worried it's too late to make a difference. Barrier number 1. Healthy food doesn't have to cost more. A bat of spinach, a can of sardines, or a dozen eggs can be cheaper than many supplements. You don't need fancy powders or overpriced vitamins, you just need simple, real foods. Barrier number 2. Worried you won't like the taste of things like sardines, kale, or fermented foods? Start small. Mix spinach into soups. Add yogurt with a drizzle of honey, or mash avocado onto toast. Your taste buds adapt surprisingly quickly. Barrier number 3. Place your safe supplements on the breakfast table or next to your coffee maker, somewhere you can't miss them. Turn this into a daily ritual, like brushing your teeth. Barrier number 4. It's normal to feel nervous about trying something new, especially when you've done things the same way for decades. But small steps, even one new habit per week, add up faster than you think. I've seen patients in their 70s, 80s, even 90s feel steadier on their feet, lower their blood pressure, and regain their confidence just by making these small changes. You are never too old to improve your health. Mrs. Evelyn, 84, used to rely on 5 supplements a day. We switched her to one safe multivitamin and focused on real food. Within a month, her headaches eased and she was able to walk to the park again without fear of falling. What's the biggest challenge you face? Cost, remembering, or taste? Comment below with one word and I'll reply with tips just for you. Now that we've removed the biggest roadblocks, let's zoom out and put all of these pieces together so you can see how food, supplements, and daily choices work as a complete brain protection plan. We've just covered a lot. 5 vitamins that can silently raise your stroke risk, how to take them safely, and which foods and routines can keep your brain sharp and your arteries healthy. Here's the big picture. Vitamin D. Take in the morning. Get your levels checked. Avoid megadoses. Vitamin E. Skip high-dose capsules if you're on blood thinners. Get it from nuts and seeds instead. Vitamin B6. Avoid brain and nerve supplements with more than 10 to 20 milligrams daily. Vitamin A. Stay within safe limits. Prefer food-based sources like carrots and sweet potatoes. Niacin. B3. Avoid high-dose supplements unless prescribed. Monitor your blood pressure if you use it. Pair safe supplements with daily movement to keep circulation strong, leafy greens, berries, fish, and whole grains to give your body the nutrition it actually needs. Better timing. No high-dose pills before bed. Your brain is not doomed to decline. Your arteries are not destined to clog. With the right choices, you can stay sharp, steady and independent for decades to come. This isn't just about avoiding disease. It's about protecting the moments that matter, remembering your grandchildren's names, enjoying walks with friends, and waking up with confidence instead of fear. Tell me in the comments which of these 5 vitamin tips surprised you the most, and which change you'll make starting tomorrow. Your story could help another senior avoid a stroke. In the next section, let's talk about the science that proves these strategies work, so you know you're not just taking my word for it. Science and research proof. I don't just want you to take my word for it. Let's look at what leading research says about these vitamins and stroke risk. Study number 1. Vitamin D and stroke risk. A 2023 study published in the Journal of Clinical Endocrinology and Metabolism found that seniors with vitamin D levels above the recommended range were 1.8 times more likely to experience arterial calcification, a key risk factor for stroke. Study number 2. Vitamin E and bleeding risk. The American Heart Association warns that high-dose vitamin E supplements can increase hemorrhagic stroke risk by up to 22%, especially in people already on blood thinners like warfarin or aspirin. Study number 3. Vitamin B6 toxicity. Research in neurology showed that chronic intake of more than 100 milligrams daily of vitamin B6 caused irreversible nerve damage in older adults, leading to numbness, balance loss, and gait problems. Study number 4. Vitamin A and intracranial pressure. According to the New England Journal of Medicine, long-term use of high-dose vitamin A supplements can increase intracranial pressure, creating stroke-like symptoms in vulnerable seniors. Study number 5. Niacin and blood pressure spikes. Clinical data published in JAMA revealed that high-dose niacin therapy, while effective for cholesterol, often leads to significant blood pressure fluctuations and may increase atrial fibrillation risk. These studies confirm what I've seen in my practice, but they also give us hope. Because once we understand the risks, we can make smarter, safer decisions and lower the chances of stroke dramatically. Have you ever had a doctor review your supplement list? Comment yes if you have, or no if you haven't. This could be the nudge someone else needs to get checked. Now, let's bring this home with some real-life success stories. Proof that when you make these small changes, your health and confidence can transform. Microstory. Real patient transformations. Information is powerful, but what really inspires change is seeing proof that it works in real people just like you. Story 1. Walter's recovery, vitamin D awareness. Remember Walter, the retired Navy vet who had a stroke from high-dose vitamin D? 6 months after switching to a safe daily dose and adding a morning walk, his blood pressure stabilized, his calcium levels returned to normal, and he's back to gardening 3 times a week.
This is your blueprint for brain safety and stroke prevention, a plan that helps protect your memory, your balance, and your independence for years to come. You are not at the mercy of fate. Every label you read, every safe swap you make, every walk you take is one more vote for a healthier, longer life. Picture yourself a year from now, clear-headed, steady on your feet, spending time with loved ones without the shadow of fear. That's what these changes can give you. Which part of this blueprint will you start with? Supplements, food, or movement? Comment below so we can cheer you on and help you stay accountable. Let's finish strong with one final call to action, so you know exactly what to do next and don't miss the next big step in protecting your brain and body. Every minute, an older adult somewhere in the world experiences a stroke, many while sleeping. And so many of those could have been prevented with one simple decision: checking what goes into the body each day. Yes, the risk is real, but so is the solution. Tonight, you can lower that risk. You can protect your brain, your speech, your balance, simply by looking at your supplement bottles and asking one question: is this helping or silently harming me? You have more power than you think. You can choose safe doses, morning timing, real foods over megadoses, and a lifestyle that supports clear arteries and strong memory. After this video ends, set a reminder in your phone to review your supplements with your doctor or pharmacist this week.
It could be the single most important appointment you make this year. Picture yourself a year from now, clear-headed, steady on your feet, spending time with loved ones without the shadow of fear. That's what these changes can give you. Which part of this blueprint will you start with? Supplements, food, or movement? Comment below so we can cheer you on and help you stay accountable. Let's finish strong with one final call to action, so you know exactly what to do next and don't miss the next big step in protecting your brain and body. Every minute, an older adult somewhere in the world experiences a stroke, many while sleeping. And so many of those could have been prevented with one simple decision: checking what goes into the body each day. Yes, the risk is real, but so is the solution. Tonight, you can lower that risk. You can protect your brain, your speech, your balance, simply by looking at your supplement bottles and asking one question: is this helping or silently harming me? You have more power than you think. You can choose safe doses, morning timing, real foods over megadoses, and a lifestyle that supports clear arteries and strong memory. After this video ends, set a reminder in your phone to review your supplements with your doctor or pharmacist this week. It could be the single most important appointment you make this year. Picture yourself 6 months from now, feeling steady on your feet, blood pressure under control, mind clear, living without the fear that tomorrow could take it all away. That's the gift of taking action today. Comment below with the one thing you're going to check tonight: vitamin D, E, B6, A, or niacin, and tell us why. Your comment might inspire someone else to make the change that saves their life. Let's close with a reminder of what's next, because we're just getting started. If tonight's video made you rethink your vitamins, wait until you hear what's coming next. In our next video, we'll reveal a simple 5-minute nighttime habit that naturally lowers blood pressure and protects your brain while you sleep. No pills required. This is one of the most powerful, research-backed rituals I teach my patients, and many say it's the reason they sleep more deeply and wake up with clearer heads. Type "next" in the comments if you want me to drop that video first thing this week. Your comment tells me this is the content you need most. Trust me, this is one you won't want to miss because it can start working from the very first night. Before you go, let's make sure you're part of this community so you never miss a single tip that could save your health. Thank you for spending this time with me today. The fact that you watched all the way through tells me you care deeply about your brain, your body, and your independence, and that is the first step toward real change. You are not alone on this journey. We are building a community of older adults who are curious, proactive, and determined to stay sharp and strong for years to come. Before you go, hit the like button so more seniors can find this life-saving information. Subscribe and tap the bell so you never miss a tip that could protect your brain or save your independence. Tell me in the comments what's one supplement you're going to check tonight. Vitamin D, E, B6, A, or niacin, and tell us why. Your comment might inspire someone else to make the change that saves their life. Stay strong, stay informed, and remember, you have more power over your health than you think. Small choices add up. You are capable of rewriting your story one decision at a time. I'll see you in the next video, where we take the next step together toward a clearer mind and a stronger body. This video is just one piece of a much bigger puzzle. In the next few weeks, we'll be diving into brain-protective morning routines, circulation-boosting meals, and surprising daily habits that lower stroke risk without medication. You'll learn which breakfast drinks improve memory, which nighttime foods repair blood vessels while you sleep, and the one overlooked mineral that could cut your stroke risk in half. If you want to follow along and build your own brain safety plan step by step, make sure you're subscribed and notifications are on so you don't miss a single piece of this journey.
Type "ready" in the comments if you're ready for this full series. When I see enough of you respond, I'll know to release the next video sooner. You don't have to make every change at once. Start small, stay curious, and remember, every day is a new chance to protect your health and keep your independence. I can't wait to see you in the next video. We're just getting started.